Nicotine, though, is actually biochemically enormously beneficial to an individual. And in fact, like, I don't even smoke, and I'm wearing a 7 milligram patch right now. And so there's a whole new body of research, supporting this. And it's interesting, you may not know it, but your body actually has nicotinic acid receptors in your body. So your body is actually prepared and more than willing to accept nicotine into the system. And one of the biggest examples for this is in the neuro area. You've got all of these nicotinic receptors that actually influence the brain. So you see people with improved cognition from taking nicotine. There's even studies that are showing improvement in for the treatment of early dementia and Alzheimer's disease. Same thing with Parkinson's.
Okay, so nicotine is has a molecular structure, and to the body, it's all about molecular structure. It has a molecular structure that's very, very similar, almost exact, actually, to what is arguably, and it's hard to say what the most important vitamin is, but an argument could be made that the most important vitamin in the body is vitamin B3, and that's niacin, also known as nicotinic acid. Chemical structure of nicotine and nicotinic acid are very similar. And nicotine, the reason I say nicotine or vitamin B3, niacin, niacinamide, nicotine, nicotinic acid, it's got various names. The reason I say arguably the most important vitamin in the body, because it's the only vitamin, which by definition, vitamins are something the body can't make. Vitamin B3 is the only vitamin that the body will make under deficiency states. That's how important vitamin B3 deficiency is.
It's a pesticide. I find that interesting. The plant produces nicotine to be protected against insects.
If you believe, or anybody out there believe, nicotine causes cancer, I ask you, please Google the question, does nicotine in itself cause cancer? ? And you will find the answer from the World Health Organization, no, it does not. You will find the answer from the Food and Drug Administration, FDA, in the America. It will say,
nicotine doesn't cause cancer.
I have a thought experiment I often suggest, which is, what would happen if we put every adult on Earth on nicotine patches every day for the rest of their lives? What would happen? Well, I can tell you right away, smoking rates would drop. Nicotine increases focus, attention, and memory, and improves. It's a performance-enhancing drug. That is actually, if you're tested for drugs and you're in the Olympics and there's nicotine in your system, that's fine. Nobody cares.
And if you didn't know this, this is phenomenal. Hey, Charlie, do you think anybody out there knows anybody with Parkinson's, Alzheimer's, ulcerative colitis, hypothyroidism, arthritis? You think anybody out there, MS? Think anybody out there in your audience has these things?
Yep, plenty.
Did you know that, let's just destroy this narrative for all of, did you know that nicotine patches are published as cures for all of those I just mentioned?
No.
What about autism? Do you know anybody in the world that has autism or autistic adults now? Did you know they have studies that nicotine patches can reverse the aggressive nature and antisocial behavior of an autistic kid in 7 days?
Really?
That's interesting. How many of your loved ones that have Parkinson's, Alzheimer's, dementia of any kind, depression, hypothyroidism, thyroid hormone imbalance, ulcerative colitis, arthritis, and autism, how many of them have ever been told or prescribed nicotine patches?
None.
A deep dive into the peer-reviewed scientific literature shows that nicotine outside of cigarettes can have positive effects on depression, high blood pressure, brain function, obesity, Parkinson's, and a variety of other issues, including Tourette's syndrome, which affects up to 10% of children.
My daughter was diagnosed with Tourette's syndrome when she was 6, and it was Christmas 2 years ago, and her tics were so unbelievably bad that, I panicked, and so I started hitting Google, just trying. It was actually at night, and I was panicking. And in Google, I found this one tiny little story about a study they did in the late 90s where they tried using a 7 milligram nicotine patch on children with Tourette's. The study said all of the children reduced their Tourette's by half. So I said, I'm going to buy a patch right now. And I went to the store and I said, we'll put it on in the morning. And my sister-in-law actually found a German version of the story which went into more detail. And they said, use the patch at night.
I had a choice to make, to watch her suffer like this, or to put a little patch on her.
So we put on the patch, and the next morning, there were no tics. It was almost that instantaneous.
We tried probably 7 different anticonvulsant medications. None of them worked. We tried the ketogenic diet. It didn't work. It was difficult.
Her diagnosis was a very, very rare genetic disorder called autosomal dominant nocturnal frontal lobe epilepsy. Looking up in the literature, and then I found a paper which is very, very interesting. This was published in one of the epilepsy journal, and it was on adult. The treating physician, after trying every single medication they tried, nicotine patch. And the idea was very similar. Okay, there may be some lack of nicotine function. Maybe we should supply.
So we decided we were going to try her on nicotine in the form of the patch, of course. And this had never been done before with a child. We didn't know how much to give her.
We had to go through a few try and error, and then finally we decided that maybe smaller size.
I gave her actually a 1/16 of a patch, and it worked. And she's been doing that for about 3 months now.
Use nicotine patches, normally used to help people quit smoking, as a treatment for a lung disease, sarcoidosis.
We're hoping that people will actually get a secondary benefit. Not only will their lung disease get better, but they'll also feel more energized and be able to get up and go.
Results from the initial clinical trial were promising, so Dr. Krauser is now doing a larger randomized trial, exploring if nicotine patches can be a long-term solution to not only help patients feel better, but reverse the progression of the disease.
And actually there is one publication now that's very recently been done in trained archers. So they had placebo nicotine or correct nicotine in the bloodstream during shooting bow. And actually it was shown that compared to placebo, they hit higher scores with nicotine in the bloodstream. So it makes perfect sense if you're a professional footballer that it might have an enhancing effect on your ability to score.
Missa inte hälsopanelen 11 februari klockan 20.00. Då ska vi prata om fördelarna med nikotin och varför det har haft så dåligt rykte. Och vad är egentligen nikotin? Hur kan det hjälpa människor? Mycket spännande forskning att se fram emot. Så håll ögon och öron öppna, så ses vi 11 februari.